Hello everyone, my name is Ines and I'm the ambassador for the Bachelor of European Public Health. Today I will give you a small presentation about my study life here in Maastricht and why I chose it. A little bit about me. I was born and raised in Belgium from parents from a very multicultural background. My dad is Moroccan and my mom is French-Polish, and I really like that international and multicultural aspect of my life. My background, I went to a scientific secondary school and my initial plan was to study medicine. In my last year of secondary school, someone came up to me and asked, "But Ines, why are you so passionate about studying medicine? What is it that you want to do while studying medicine?" And what I said was, I really want to help people, I want a better healthcare, I want to improve health systems in third world countries. And everybody was like, "But Ines, you can't do that as a doctor. As a doctor, you treat patient per patient." And that is why I redirected to the Bachelor of European Public Health here at Maastricht University by wanting to make a change at a larger level. Why Maastricht University, you would ask? Well, amazing education for a reasonable price. I was looking at programs in the United Kingdom and the US, and those programs were extremely expensive, and Maastricht offered really good education for a reasonable price. It is also the center of Europe and a beautiful city, so I thought, okay, this is it. How does my week look like as a Bachelor of European Public Health student? So I added a screenshot of my program, and you can see that on Monday I have a tutorial and a workshop. On Wednesday you can see that I have 2 lectures. Some are practical lectures, so they are about, for example, methods, methodology and research, and also another workshop about statistics. And then on Thursday I would have a lecture with Professor Rock. We call our professors by their first names, and he actually has a really great background. He has been a doctor and worked for the World Health Organization. So I really like that our professors have experience in the field and are so interesting. And then you can see that I have another tutorial on Thursday. The time in between those days are considered self-study time, and then you will prepare for your tutorials, for your workshops or your exams. Study life. Well, the beauty of PBL, I always say that I love problem-based learning. I think it's a great opportunity to actually practice your knowledge, and it's more of an applied way of learning. Also, what I like is that you can combine studying with sports or with working. Consider that you kind of self-pace your knowledge and your studying. And yeah, I wouldn't see myself looking at a screen for several hours in a day and having lectures from 9 to 5 like it is the case in some universities. Student life in Maastricht, wow, amazing. I added some pictures because pictures say more than 1,000 words. You can see like some pictures with my friends. You can see a picture of food because I'm a real foodie, and Maastricht has amazing choices of food and a variety of different cuisines. I love Maastricht during Christmas, so I added a picture of the Christmas tree. And of course the parks, the nature, the fact that it's a small city with a lot of green space, non-negligible. And in the middle you will see my Unitas board. I was the president of the study association, and it's just a very nice opportunity to meet new people from your own program. So please reach out to them if you come to study European Public Health with us. Well, people always ask me, but what can you do with a Bachelor in European Public Health? Well, I will start my professional life by doing an internship at the European Monitoring Center for Drugs and Drug Addiction. This is where I will write my thesis and is it part of my bachelor. What I want to do in the future after that? Well, in general, just bettering healthcare and making sure that everybody has access to it. How I will do that? Well, I hope to work at a European institution to start my career, and maybe also pursue it at the European Monitoring Center for Drugs. I don't know yet, but I'm excited to see it, and I'm sure that with all the possibilities that our professors give us, I will have a great career path. What's next? Did I convince you? Then I would suggest that you join us at one of the experience days. You can see the link on the screen, and apply for European Public Health if you're completely convinced. The deadline is 1st of May. I have an Instagram. You can follow my day in my life. I post about my daily life, student life, university life, and Maastricht in general. I also posted a reel about a day in my life at so you can see what it's like. And you can ask me questions through DMs, direct messages on Instagram, about everything. I try to answer as fast as possible. I would like to wish you good luck with your study selection and hopefully see you soon in Maastricht.